This is my presentation, and these will be my two people watching me as I present. My presentation will be over the hepatitis D virus. And so the hepatitis D virus is also known as the hepatitis delta virus. And it attacks the liver, and it could cause the most severe form of viral hepatitis known to humans. And so, even though this virus is very easy to contract, it can only survive with the hepatitis B virus. So, unless someone has the hepatitis B virus already inside their system, they cannot get the hepatitis D virus. So, what is in the hepatitis D virus? It has many components. The virus structure of the hepatitis D virus consists of a RNA genome, a single hepatitis D virus antigen encoded, and a lipoprotein envelope, which is provided by the hepatitis B virus. When looking at the shape of the hepatitis D virus, it is very small and it has a spherical shape to it. Um, it has a 36 nanometer diameter, and its outer coat, the virus contains three different types of hepatitis D viruses: small, medium, and large. Um, the in the surface of the hepatitis D virus, it has the antigens, and it hosts lipids that surround the inner nucleolipid or the nucleocaspid. So, when looking at the risk of infection, you can obtain hepatitis B through any sort of fluid. So that means if it's semen, if it's saliva, if it's blood, uh, contracting those fluids in your mouth or in your eyes, that's how you become infected. So through the infection of hepatitis B, you can get hepatitis D. So when looking at groups of people, some of the most common groups would be in the healthcare. So at hospitals, it is highly likely for someone to be at risk of obtaining this disease. Um, because of the amount of sick people that are there. So people that work with blood or body fluids as routine part of their job, including healthcare workers such as doctors, dentists, nurses, blood and lab technicians, and students that are in there, they are high at risk of getting the hepatitis D virus. Uh, and then people in prisons who are inmates and the people that work there, they're also at high risk because of the amount of different people that are in there with the amount of different illnesses. So the people that follow these behaviors and have these jobs, the health field workers and the people in the prison system, are high risk for becoming infected with hepatitis. Now, focusing on mainly just hepatitis D, not just B, the two main groups would be drug users, mainly the ones with needles, and the homosexual community. Even though transmission is very easy to get because as dealing with bodily fluids, the risk factor of or the impact it has on society is not large because within the United States there are less than 200,000 people that are infected with hepatitis D every year. So, what does hepatitis D do to the human body? Once contracted, this virus will attack the liver, causing it to inflame and become swollen. Now, when the liver has become inflamed and swollen, it can cause serious damage, making the liver uh, severely damaged. The swelling from the affection can cause the function to slow down and even stop. Which then, if your liver is hurt this bad, it will ultimately cause things like cancer and heavy scarring. Now, if your liver is attacked so much to where it can no longer function, the person that is affected will then need to have a liver transplant. And about 78% of people that have liver transplant ultimately live about 5 years longer than they would if they didn't have the transplant. So, a unique characteristic of hepatitis D is how it reproduces because it does it in a similar sense of how plant viruses do. So, what it does is the virus genetic material is connected to the host's liver cell. And with that, the virus will incorporate the surface antigens from the hepatitis B virus, which was already there, and then it will put that into the cytoplasm, and then from there it will create new hepatitis D cells from the host cell, which then allows it to infect the body more. So obviously, you don't want to deal with the hepatitis D virus, so you want to make sure to look for symptoms. Now, one major problem is that the symptoms of hepatitis D are very similar to hepatitis B also. So whenever you start receiving these symptoms, you won't always know which one is which causing these problems. But for hepatitis D, you're going to want to look for things such as abnormal fatigue, darker urine, vomiting, which is already a sign that your body is sick, pain in the abdominal area, a loss of appetite, joint pain, and jaundice. And this is the yellowing of your eyes and skin and even your fingernails. So no one wants to deal with hepatitis at all. So you're going to make sure that you get the proper treatment. However, when contracted with hepatitis D, there is no cure itself, and treatment is very limited as of now. But the best method currently is to take large dosage of a medication called interferon for about 12 months. This type of protein that can stop the virus from spreading and lead to temporary recovery from the disease. However, even after treatment, people with hepatitis D will still test positive even though they did this treatment. So afterwards, you still need to make sure that you're taking the proper precautions no matter what you're doing to not spread this virus. So after everything, you need to make sure that you understand and are educated on how to prevent yourself from receiving hepatitis D. Like I said earlier, you cannot have hepatitis D without hepatitis B. So to stop yourself from getting hepatitis B, you need to make sure that you are vaccinated, have safe sex, and take precaution measures when getting tattoos or piercings. So with vaccination, you can get vaccinated for the hepatitis B virus, which then eliminates your chances of getting the hepatitis D virus. Children are commonly get this virus, and with adults, there's a process within about 6 months where you get 3 shots, and that's how the vaccination works. Now, with safe sex, hepatitis can come through bodily fluids. So you want to make sure that no matter whether it's homosexual sex or heterosexual sex, whatever partner you're engaging with, you want to make sure that you're engaging in safe sex, and if not using protection, make sure that your partner is clean from any sexual transmitted diseases or, of course, hepatitis. And lastly, you want to make sure that if you're receiving a tattoo or piercing, that the environment you're in and the shop you're getting it from are run properly, because you want to make sure that the needles going inside your system are not dirty or infected with this disease. So you want to make sure to ask your tattoo artist how they clean their instruments and how the process is done to make sure that you do not contract any diseases. And that is my presentation. Thank you.